Hi.
Hi,
How
my
are-
name is Matt. I'm Meteorology PA.
Hi.
Hi.
Good
We saw
morning.
you a couple times last week, and before that,
She's
you've
my
seen
favorite.
She's your favorite. So sweet. So I heard you were having some problems getting up and walking around, so they had to put a catheter back in.
In your bladder.
They put a catheter back in
Okay.
3 days ago.
Yeah,
Okay.
yeah, but he hasn't been, yeah.
Yeah. I haven't seen you. I'm sorry. No, yeah. We've been off because you were peeing last we saw you.
I was peeing.
Yeah, you were peeing. Well, must not have been for very long. Maybe a day or two. Yeah. Do you mind if I take a look at the catheter?
Right.
Is it bothering you?
The catheter?
Yeah.
No.
Okay.
Who said it was bothering?
Nobody. I was
He's just asking.
Oh, okay.
You have his undivided attention. We need to ask all the questions we can.
Yeah. They called us originally because you had some blood in the urine.
Right.
Yeah.
But now that's
And now that looks great. Yeah, I don't see.
There's a little bit of sediment in the bag over here, Matt, but it's nothing.
or the.
A
Oh,
little bit of it. Okay, sorry, that was me pinching you. Any of that hurt?
no.
Okay. So they did a scan over the weekend because you were in a lot of pain, correct? And that's showing a little bit of gas and fluid tracking either to or from the bladder. Okay? And they give us a call. And they say, hey, could this be coming from the bladder? It's not coming from the bladder. Let's figure out where it's coming from. Right? Okay. So that's not an ideal image for us to evaluate the bladder.
Right.
So we answer with, let's get a good set of images. That is a CT cystogram, cysto meaning bladder, gram meaning picture. We can either do that with x-rays or a CT is a little more detailed. Okay? So I reached out to radiology to see which one they could do sooner. I think we could do the x-ray later today, but they're still working on the schedule.
Is one better than the other? Like advantageous? Is it worth to wait for the one that shows more than the x-ray if you can get it today versus tomorrow?
Right. Our suspicion's pretty low that it's coming from the bladder.
So where would
So-
it be coming from? Or
Correct.
okay.
Yeah. And you've had a lot of CT scans already. So it's kind of like we would prefer to do the least amount of imaging we have to get our answer, right?
Okay.
And that would be the x-ray. But the more definitive and more detailed one is the CT scan. So we'll probably try to get to the CT scan since we have some questions about
But they have to-
to be more like,
They
hey,
have
we
to take me
really
off
check.
the stable.
What's that?
They have to take me off the stable.
Right. So it would be.
But Mom, whatever, as long as they give you the pain meds beforehand and plan accordingly, they may have to move you just to get the CT scan. But they just have to plan your med management before, because that's when they don't plan is when she's uncomfortable when they move her.
Okay.
Do they do a PET scan or no?
Yeah. Right.
That doesn't help us.
Where's
Oh.
my suction?
That's more for like
Oh, your
cancer.
suction thing.
I know. I'm a cancer survivor, so I know the PET scan shows
This is my daughter.
everything more stuff than you even need to know how it's working. That's why.
Yeah, but it,
Yeah.
no, it doesn't help us.
Okay.
Okay, and if it's a leak, a bladder leak, we can talk to you about management of that, like depending on how big it is,
Yeah.
and where it is, and sometimes they heal on their own.
I don't
It's very
think-
vascular.
I'm not having
bladder.
any pain there.
No, okay.
That's not where the pain is.
So in the pain she's having,
Yeah.
Is there? Well, I have a couple questions.
Sure.
Because we haven't heard anything other than everything status quo from the nurses. I mean,
Mhm.
that's all we hear. Everything status quo. We don't really know how long could she be in here. I know things are status quo and we're trying, the med management is a key thing, because she's in pain when they try to move her. And she said today we told her she has to take the pain meds and she has to do the PT and OT so she can, get out of here or just kind of do it. Do we have any date? Could this be a week, 2 weeks, or?
So Matt is with the urology team, so he's only here to talk about the bladder.
Oh.
I'm with the trauma team,
Okay,
so I
so
can answer your other questions.
fine.
Kind of more of a comprehensive.
That's fine, as long as we get answers, because we
Yeah.
haven't had any answers. And the other thing, and I can talk to you after, I just want to know, is it okay, visitors to come? Is it not good? Is it
No, that's
good?
That's great. We love visitors.
Okay, even though with COVID, it's not an issue?
It's okay as long as we follow the precautions the hospital put in place.
Oh, okay. Well, that's good to know, because we don't know. There's 5 girls. I mean, we don't know. Do we tell people to come in? Do we tell them not to come in? I know it's...
You'll be limited to coming back here at like one or two people at a time.
Yeah, I know that. Yeah, okay.
And there's hour restrictions.
Yeah, 11 to 7, yeah.
Right. Yeah, outside of that. And so some of this will depend, if we see a leak, we would talk to you about how we want to manage it.
Okay.
Again, knowing that some of these can heal on their own
I'm
if they're small.
completely lucid.
Good,
You
good.
can just
Yeah.
run it by me.
Yeah, yeah,
Because
She
I'm
makes
the
the
one
decisions.
that's
Great.
having it,
yeah.
and I still make my own decisions.
Good, good.
That's the
And then,
trouble
if-
I have. I have 5
Worst case, we would have to
decisions.
go in and repair it.
5 different
Which the other ones
decisions.
we kind of hard to get to, so we would
Yeah.
have that
That's
conversation.
the trouble I
when
have.
it
Yeah.
happens.
I have 5 different decisions.
Yeah.
Yeah, 5 girls and 5, right. So while you
Somebody's
can make
looking
the
out after you,
decision,
look at
yeah,
that.
while you can
Really
make the
nice.
decision, you make the decision. And whatever decision you make,
I
then
made
we're
the
good.
decision to be out of here.
Okay,
Either to be out of here one way or another.
okay.
And I was choosing the other way. But I think I'm gonna make it this way.
All right. So I know you don't
He
like
knows what I'm thinking.
Yeah, we all do, Mom.
you don't like getting up and going to the CT table. You've done that a couple times, but you're willing to, correct?
Of course.
Okay. All right.
She's the best patient you're going to get here, because she follows directions.
Mm-hmm.
She asked how many times did she count. She does what she needs to do. If anyone has a will, it's her.
Yeah. Right. That's what you need. All right. Let me keep reaching out to radiology.
Okay,
We'll try to see timing on those.
okay.
Okay.
After payment.
And they
Correct.
just gave
Not
her about
before.
an hour ago, I think like 11 when I got here. They gave her some pain meds. So I don't know.
Probably his images
It-
won't
it's-
happen until after our
Yeah,
next round of.
No, that's okay. I just want to let you know which you'll see in the thing at 11 o'clock. So just as long as we could plan, if it's possible, so she'll have less pain
Yeah, and we
when
can
they have
always
to
give
move.
her an additional dose.
Okay.
Right before she goes down.
That would be great.
Yep. And they would just be putting keep your catheter, your Foley catheter, they'd be putting some contrast in there, watching the bladder expand, 250, 300 cc's of iodinate contrast. They would take a bunch of pictures, and we would see if it's
They did
leaking.
that.
Yeah, they did that.
Yes.
I think.
And that was negative. It didn't show any leak. So
Yeah.
our suspicion's pretty low, but we need
Better
to say,
safe than
rule in,
sorry.
rule out that is it coming from the bladder or is it just tracking along and touching? Okay?
It's from the pelvis.
What's that?
From the pelvis and the ribs.
Are the
That's where
fractures,
they-
correct. And the pain, you said? Okay. All right, we'll keep in touch.
Okay, thank you.
All right. What questions can I answer?
So,
She's from a different team.
I'm from the trauma team.
okay.
She's my favorite.
Okay. So,
She's an action lady. She gets things done.
Right.
That's why you connect.
That's right. Well,
So-
it helps that I'm the one that's allowed to order stuff for you because I'm the primary teacher.
No, but she goes and she gets it.
Yeah. So
See,
I mean,
don't have to wait.
I think one of it is having visitors. I know it's hard for her to talk, so we all told her, people should text. Don't you know what I mean? Is it okay for people to come? Is it not okay? Should we limit it? It's okay. Okay. And
It
does
makes
it?
you feel better, and then as long as they know that they'll only be able to come back 1 or 2 people at a time.
Right.
So yeah, that's absolutely okay. There's no restrictions.
Okay. As far as pain, this is just something I was thinking of, and it may be it's probably too early now, but because I know she has reaction, because she always, even Tylenol or Advil was a big to do. If she took Tylenol or Advil,
Does nothing.
but Advil, it was like, it had to be pretty bad. She's not one to take medicine because it makes her feel icky. Because I know we're trying to get this under control, would like a gummy, something that's medically, is there some other form that, I don't know if a gummy would make her nauseous or it was making her sick, so they had to take her off whatever, the other day. Is that something just to consider, that whether it be now or down the line, that may
No, it was
help
a
the
new-
pain?
It was a new thing.
It's the
And
kind
she-
of,
Yeah, she was
It
they kind of
It didn't agree with me.
and she was like throwing her, like jumping out of her skin. So I don't know if something like that is
usually
something.
the oral stuff actually makes people more nauseated. So
Oh.
she's been getting IV stuff. The ketamine didn't agree with you, so
No.
we shut the ketamine off.
Yeah.
The pain service is following her, and they are giving the IV pain medicine right now.
Okay. So, but how long can IV pain medicine? Could it be for long? I mean,
Well, she can't be discharged.
I know.
So the questions kind of actively being discussed right now. You have all these pelvic fractures on both sides of the pelvis, and then the left hip is also the little socket where the ball goes into. That's fractured as well. Dr. Garapati, who did your hip in 2019, is the original surgeon, the orthopedic surgeon who looked at the images, and he said there's nothing to do for them operatively. So the recommendation when we first came in 11 days ago was non-operative management. Weight bear is tolerated, meaning get up and use the walker, work with PT as tolerated. A number of days went by and she wasn't able to do anything with PT and OT because the pain was excruciating in the pelvis. So we asked them again, are you sure there's nothing we can do to make her more comfortable because she's not able to tolerate anything?
Right.
So he looked at the images again and said, I agree with my original assessment, there's nothing more to do. We ended up putting the catheter back in because nursing care was so uncomfortable for her to have to roll, to have your bed sheets changed, and we had that little wick catheter there that wasn't working. So, and then over the weekend, just because the pain had not diminished to the, normally we expect the pain to subside over a few days, not go away completely,
Yeah.
but we weren't seeing as much improvement as we would expect after 10 days. So we got another scan of the pelvis, looking at the bones. Matt was saying it wasn't an ideal scan to tell him much about the bladder, and that's because we didn't get it for the bladder.
Right.
We got it for the bones. What it shows is that the bones are still in the same fractured positions that they were in before. Excuse me. So nothing shifted, which is good. Dr. Garapati looked at the scan again today. Nothing to do. So now the question is, where is that air coming from? That's why the pelvic bones. Is it coming from the bladder? So that's what we have to figure.
Okay.
And then there's still blood.
So we're where?
Still blood coming?
No. No, so when she came in, there was, the arteries were bleeding, where the bones had injured the arteries into the pelvis, and she went to interventional radiology, and they were able to embolize those areas, meaning clot them off. So that
Right. Right.
we are not concerned that she's still bleeding.
Okay.
So that's good. We're back to hopefully there's no bladder injury, there's nothing that the urologist needs to do. but it still doesn't help us much. We haven't made much forward progress with getting the pain under control. So we don't want you to be stuck in a bed for 8 weeks while your pelvic bones heal. So we just need to figure out with the pain service, those are anesthesiologists that specialize in pain control, and with the physical therapist, and the occupational therapist, and the bedside nurses, what's the right timing of pain medicine so that it's optimized so we can start mobilizing it.
Right. And she said today she was much better when she did it and she was able to sit up for 10 minutes.
That's good. That's good sign.
Yeah.
So,
So,
and
we,
Dr. Garapati was saying sometimes this takes 8 to 10 weeks.
yeah, but in the hospital, 8 to 10 weeks?
No, but in order to get to a facility, like a nursing facility, we would have to be meeting certain checkpoints that we're just not at yet. Like you'd have to be able to participate some with physical therapy, and you'd have to be off IV pain medicine, and we're just not there yet. So you're here for a few more days, at least.
Like, do you think it's like a week or 2 weeks, or do you think it's really...
Can't really say. It just depends on, as long as the urologist say there's nothing that they need to do, and then we're back in the boat of it's only pain control that we're working on.
Right.
Then it could be a week, probably not likely to be 2 weeks, but it's hard to say.
Okay.
We're both
And-
coughing.
Yeah, and,
When
well,
can I drink water? I mean, when can I swallow without choking? Because then I start the quiet. There's nothing wrong with
she's
the
been
swallowing.
she's been coughing
All
for
my
40
life.
years. So, like, some of the, like, that phlegm, the cough, that's... Actually, I think she's doing better right now than she has normally
But
when
I
you're
have-
around her. But she
I
does...
have asthma and I have allergies. So I'm allergic. So if I'm outside or I get a whiff of
Or sometimes I have trouble swallowing, like the chicken, Mom. She had trouble, and that I don't know if that's something...
Yeah. So the speech and swallow team did see you, and they are the ones who are kind of directing us on
And-
how thick the liquids need to be and all that sort of stuff. But we don't believe that this is related to your
no.
traumatic.
It's not. It might be compounded or whatever it is.
Certainly not helped by needing to be basically flat on your back in a bed.
And coughing with the ribs, right.
So the best thing that I can say right now is get the pain under control, get you able to sit up in a chair maybe even, or at least sit straight up in the bed, and then, the coughing should hopefully get better because you won't be confined to this.
I just want to be able to swallow and breathe. That's all
Those are simple things in life, right? We all want those things, so let's.
I mean, I have to start with
Yeah.
the pain. Well, I got the pain. What? But if you can't breathe and you can't swallow, you're in big trouble.
Yeah. So the breathing is impacted by your pain. It's hard to take a deep breath and clear all that junk out of your lungs when you can't take a deep breath and cough without pain. So we see this often when people have fractured their ribs, that they don't take deep breaths anymore, the junk builds up in the lungs that normally you would cough up, you get a pneumonia, that's no good. So we're giving you antibiotics right now because your chest x-ray did show early signs of pneumonia, and we just wanted to make sure we caught it early. So you've had, a number of almost 7 days now, 6 days today, of antibiotics. So I think we're preventing a pneumonia or treating an early pneumonia at least, but I still don't like the junky cough that you have. So I think getting up and working with PT and doing breathing treatments will help, but in order to get there, you have to be able to comfortably work with them. So just kind of stuck here. So over the weekend, you and I have talked about this a number of times already. Is the pain primarily in the pelvis or is it in the ribs? And initially the pain was mostly in the pelvis, but we're thinking that may be because when she came in, we had done a long-acting nerve block
Oh, yeah.
of the ribs, and that's wearing off or gone completely. at
I
this point.
wanted another one.
We're gonna have Dr. Kalmo, who did your first one, assess. I think she's here tomorrow. The pain service does do blocks, so I'll talk to them today when we touch base about you, because we talk every day, to see is there someone here who can do that. It takes special training to be able to do that type of block.
And how many pain blocks can you get? Is it so many?
That is a really good question. I think it's more limited by, you have to wait a certain number of days in between,
Okay.
so that whatever pain medicine
They
that they
test
infuse
36 hours.
36. So she's in the window to get another one now.
Away in the window.
Yeah. So if
That's why I wanted, when the 3 days, when the 36 hours were up, I asked for it.
I know, I asked them too.
But they didn't give it to me.
The pain, so I'll see if the pain service has anyone that can do it today, that specializes in that training. But
Okay.
otherwise, Dr. Kalmo, who did the first one, will be here tomorrow. Dr. Kalmo is kind of a special doctor in that she's a general surgeon who does gallbladders and appendices. She's also a trauma surgeon who does, care like yours. She's also an ICU doctor, so she does critical care, and she does this special pain control stuff. So she's a woman of many hats, very skilled, and she will be back tomorrow.
Is there a way of trying to see if she at least can get scheduled to have it done tomorrow?
She's actually the trauma surgeon who's rounding on our whole service tomorrow, so she'll for sure be here tomorrow.
Right, that's what I'm saying. Is there a way of trying to make it happen tomorrow so at least we know she's here? If there's a way she can.
So tomorrow she's actually going to be the attending who's primarily in charge of your mother.
Oh, so-
she's like, the trauma surgeons change every day, and she hasn't been on as the trauma surgeon since
Okay.
your mom was admitted.
Oh, so she'll see my mom anyway,
regardless. 'Cause
but
she's
can
been-
she immediately decide I want to do surgery on her today? Does she actually do the surgery or?
it won't be a surgery. It'll just be a nerve block.
Oh,
So it's
so
like-
she could do it tomorrow when she's here
Yeah, that's our hope.
without scheduling for it.
Correct.
Oh, okay,
But,
that's what I was
you know,
saying.
as long as it's like
It-
we're not crazy with a trauma that comes in, or
I get
emergency
that.
surgeries. But yeah, that's our hope. Is since she's going to be here anyways tomorrow with our team, that
Okay.
we will be able to come back and do it at the bedside to make you more comfortable from the ribs. We'll do nothing for the pelvis. So the pelvis is still,
That's going to be 12 weeks.
it could be 8 to 10, 12 weeks according to Dr. Garapati. So
But I think I can live with that. I can't live with not breathing.
yeah.
And the more pain medicine you give me, the lower my breathing rate.
So this has kind of changed over the last few days, because a few days ago when I saw you, probably when the nerve block was still on a little bit, you were primarily bothered by your pelvis at that time. And now it's like, as the lung or rib pain ratchets up, that bothers you more. So now we need to knock that down again, since it's within our control. There's nothing we can do for the pelvis. That's in Dr. Garapati's hands, and if he says I can't operate on it, then we just have to time to heal. So, but the ribs we can fix. We can make better.
And the breathing, is that part of the lungs?
That's part of the lungs.
Okay.
Because she has multiple rib fractures,
Uh-huh.
it's excruciatingly painful. Rib fractures I've never had them, but I've heard many people say they're one of the most painful fracture types you can have, just because there's so many nerves in that area.
Yeah.
So we just need to make you more comfortable. Okay?
And so how do this has been really helpful, and I know you'll write it down in the thing, right? Because my niece, who's a nurse practitioner, Jessica, she's kind of relaying it to all 5 of us or whatever it is. But how do we get information like this? Like,
We can call you.
I know, but she's asked, and we get from the nurses, like in the morning or at night, we get she's not getting any
We can call
information.
you. We, the medical team, the providers, not the bedside nurses. If you have,
Jessica, she's our primary contact.
I can call her and give her updates.
Okay, so because we haven't gotten any of this information, so that would be fabulous. And she's the one who's checking in just because she knows she was with my mom when they did the whatever it is, but she understands, so she at least can tell us in layman terms.
I can call her and give her updates.
Okay.
I'm here at least Monday through Friday, if not on the weekends also.
You gotta
I'm gonna have
move.
to run. I have
Okay.
a couple of consultations
Thank you.
to see, of
This has
course.
been wonderful,
Let
and I
me know
really
if you have
appreciate
other
it.
things that come up. I'm here until at least 6 tonight.
Okay.
Okay.
Thank you so
All right, good
much.
to see you, dear.
You too.
Just take the stuff off of the tray. Put it down. Put the tray in.
What?
Push the tray straight. Then you turn the table around.
Hello.
Can I change your heart monitor battery real quick? It'll take like 2 minutes.
Sure.
What are you gonna do?
Your heart
Do you have
monitor.
your heart monitor now?
Sure. Why not?
Let me just- I'm holding the. I'll hold your hand. I'm just holding this. She's going to change your heart monitor. In,
Yeah. Can I ask you where it is? Is it in your pocket? Oh, it's right
is it right here?
Yeah. Do you mind handing that to me? Thank you very much.